Alright, let's dive right into this explainer and completely demystify the science behind human worry and mental health. Welcome! Today we're taking a really structured, data-driven look at a topic that honestly touches almost every single one of us in some way: anxiety. We're going to rely on rigorous clinical info from leading health organizations to figure out exactly what happens in our brains and bodies when fear takes the wheel, and, much more importantly, how we can hit the brakes. So let me ask you, are you worried that you worry too much? It's something a lot of us think about in those quiet moments of the day, right? Does your brain's alarm system go off even when there's absolutely no fire? Look, we all feel nervous sometimes, but today we're going to explore what happens when that feeling doesn't just fade away, but instead amplifies and completely takes over. Here is our quick roadmap for today's explainer. We'll start with normal worry versus an anxiety disorder, move on to the common types, dig into the symptoms and root causes, look at proven treatment options, and wrap up with taking back control. Okay, let's jump right into section 1. Normal worry versus anxiety disorder. Think of everyday anxiety kind of like a temporary spotlight. It actually kicks in beneficially for a very specific event, maybe a big job interview, taking a final exam, or, noticing a dangerous situation in traffic. It keeps you focused and alert. But an anxiety disorder, that feels a lot more like a tornado. It's totally disproportionate, it's overwhelming, and it heavily interferes with your ability to just function in daily life. You essentially lose control over your own response. To put this into perspective, and honestly, to completely destigmatize the whole thing, let's look at the sheer scale of the issue. 1/3. According to the National Institute of Mental Health, about 1/3 of US adolescents and adults will experience an anxiety disorder at some point in their lives. So if you're struggling with this, you are absolutely not alone. It is a widely recognized, deeply studied medical condition impacting millions. Moving right along to section 2, common types of anxiety. What's really fascinating here is seeing how completely different triggers mount to distinct disorders. Take Generalized Anxiety Disorder, or GAD. The trigger there is just the sheer weight of everyday activities, health, money, or literally just basic chores. People feel totally powerless to stop the worrying. Then you have Social Anxiety Disorder, which hinges on a really deep fear of humiliation or negative judgment from others. Panic disorder is a whole different ballgame. Periods of sheer terror happen unexpectedly without any warning, sometimes even while you're sleeping. And agoraphobia is the intense fear of places where escape or help might be difficult, which leads people to avoid crowds or even refuse to leave their homes. So it's the same underlying family of disorders, but completely different catalysts. And looking at the demographics, the data tells a pretty clear story. Research consistently shows that women are about twice as likely as men to develop an anxiety disorder, and that includes specific conditions like panic disorders and phobias. This is a really critical piece of data for understanding how these conditions impact our population so differently. Now, speaking of phobias, let's define that. A specific phobia is an exaggerated, disruptive fear of a particular object, animal, or situation that doesn't actually pose any significant threat. Affecting up to 12% of the population, specific phobias are actually the most common type of anxiety disorder. Whether it's an extreme fear of spiders, flying on airplanes, or, hey, even going to the dentist, it causes people to drastically alter their behavior just to avoid coming face to face with their fear. Let's pivot now to section 3, symptoms and root causes. It is absolutely crucial to realize that this is not just all in your head. The psychological dread is matched beat for beat by severe physical disruptions. A racing heart, palpitations, shortness of breath, intense muscle tension, nausea, sweating. These are very real biological responses happening right there in your nervous system. Psychologically, you're dealing with uncontrollable dread, uneasiness, irritability, a total lack of concentration, and insomnia. When you stack the mental on top of the physical, it becomes incredibly obvious why living with this condition is just downright exhausting. So why does this false alarm keep going off? Well, it's a real biological mix. It can stem from chemical imbalances involving neurotransmitters like serotonin, dopamine, and GABA. Those are the guys that manage your mood and stress. It can also be structural, like overactivity in your brain's fear center, the amygdala. Then there's the genetic lottery. If a first-degree relative has an anxiety disorder, your risk is just naturally higher. And finally, severe environmental stress and traumatic events can literally rewrite the balance of those chemicals in your brain over time. All right, let's get into the good news in section 4, proven treatment options. The really great news is that treatment today is incredibly effective and usually involves a tailored combination of tools. On the psychological side, talk therapies like cognitive behavioral therapy, or CBT, help you actively spot and reframe those negative thought patterns. Meanwhile, insight-oriented therapy can help explore unresolved past conflicts. On the medical side, antidepressants like SSRIs and SNRIs can jump in and adjust those brain chemicals we were just talking about. And beta blockers, they can provide super fast, short-term physical relief by literally slowing down a racing heart in the moment. Your healthcare provider basically acts as a partner to build a combo that works uniquely for your brain. Take exposure therapy, for example. It's this fascinating, super deliberate process for treating things like specific phobias. If someone is absolutely terrified of dogs, step 1 might literally just be looking at a photo of a puppy. Step 2 is sitting with your eyes closed, imagining that same dog sitting across the room. Step 3 is slowly, eventually approaching the actual animal in a highly controlled, totally safe environment. Over time, this slowly retrains your amygdala to attach realistic, safe beliefs to the very things you used to be terrified of. Which brings us to our final section, taking back control. Because alongside professional medical care, you literally have a toolkit you can use right now. Mindfulness meditation actively calms your body's stress response by forcing you to stay in the present moment. Getting some regular exercise naturally boosts your mood, and basic relaxation techniques like deep breathing can actually help neutralize a panic attack as it's happening. Also, and this is a big one, simply cutting back on your daily caffeine can drastically reduce physical symptoms like those heart palpitations. Finally, joining support groups connects you with other people so you can share coping strategies, and just remember, you aren't fighting this battle alone. Now, why is it absolutely crucial to take these steps? Because left untreated, anxiety compounds into some pretty severe complications. It vastly increases the risk of major depressive disorder, substance use disorders, and because of that constant, heavy cardiovascular stress on your body, it even increases the risk of cardiac events like heart attacks. This isn't just worrying too much, it is a serious medical issue that absolutely requires attention. Which leaves us with one final, pretty provocative question to chew on. Are you ready to stop letting fear write your story and actually take back control? You do not have to just grit your teeth and live with constant, exhausting worry. As we've seen throughout this explainer today, whether it's through cognitive therapy, medication, or just some powerful lifestyle changes, there is proven, accessible help waiting for you right now. Thank you so much for joining me to explore the science of anxiety. Remember, you absolutely have the power to change how your brain responds.